Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Thank you for watching. I'm either in Westlake, Ohio or Naples, Florida, and we enjoy having you come to visit us from anywhere in the world. First question, it's quite detailed. I'm not going to read it verbatim. You can look at the script as a part of the video, but we had a 56-year-old individual who's been on a beta blocker for her high blood pressure since she was 24 years old, and it goes into great detail about her heart being altered when she's been waking from sleep. Now you have to imagine, she started a beta block when she was 24 and she's now 56. And the conversation goes on when she bears down, which is called the Valsalva maneuver, by the way. That alters a nervous system in your body. She said she had been to many doctors without any one of them giving her a reason. The beta blocker could be a part of the problem because it's altered your sympathetic and your parasympathetic nervous systems, which is intense for me to share that conversation with you right now. You may want to get Dr. Bob's Guide to Sex and Romance, because in that book we talk about the parasympathetic and sympathetic nervous systems. But in our office here in Ohio and in Florida, we have a tool called the Heart Sound Recorder, which we can listen to heart sounds, because the heart is a direct reflection of what's functioning inside of your body. So I wanted just to be aware of that. Look up Valsalva, parasympathetic, sympathetic nervous systems. You may need some magnesium. You may need other minerals. You could look at your GTTP. You may, that's a blood test, by the way. You may consider having a blood chemistry with us. Quite detailed, but it's very important. We see a lot of heart challenges in the office. We had an individual who had a friend who had a PSA of 33, which is quite high. He had a bone scan looking for cancer spreading because of the bone absorbing and having all of the radioactivity absorb this, so you would know if there's any kind of a lesion. This is what we do at prostate challenges. We always want to lower estrogen in a man, and that's definitely part of the problem. We support liver function. Liver function is significantly very, very important because that clears the extra estrogen, and we also use iodine. You may consider having a urine iodine loading test. Dr. Bob, I was recently at a podiatrist. You're having an issue with the big toe in your right foot, and he basically wanted to know what to do about it. Should you or should you not have the surgery? Well, having bunionectomies or big toe surgeries is quite common. We've had many patients that have had that done. You want a skilled podiatrist because there's different levels of people's ability. You're going to want to ask around. It's not a wrong thing to have done. Dr. Bob, I watched a video of yours on DIM, and DIM happens to be a product that helps lower estrogen, and you wanted to know that I didn't really answer the question. Well, here's what we try to do. Regardless of the product, our goal is to lower one's estrogen, whether it be through the liver, whether it be through B vitamins, whether it be through a castor oil pack. We always look at the individual itself. We do not have DIM in our practice. Last question, Dr. Bob, your recent shake that had the video on the strawberries, can you talk about that? Okay, that was a real interesting video, the shake they had. We've got a lot of different opinions from people in regard to it. So let me share this with you. This happens to be a bag of strawberries I use as a prop. These are grapes and this is sugar. And what I learned in the 1980s, people with chronic neck and mid-back pain had the same pattern. It was anything that aggravated the pancreas. If you want to eat strawberries and bananas and watermelon and potatoes, go ahead and eat it. But 90 to 95% of the patients that come into our office, their pain is on their left neck and mid-back. So if you want to suffer with left neck and mid-back pain, you can continue eating them. And maybe some of you don't have any pain with eating fruit, and that's okay. What we have found from our experience, if you limit fruit, pain will go away, especially sweet fruit, bananas, raisins, grapes, strawberry, pineapple. So try it for a month. You'd be amazed at how many people have told us that their inflammation in their body has gone away. I'm Dr. Bob DeMaria.